Assalamu alaikum. I am Dr. Mahbubur Polash, Assistant Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Welcome everyone in our today's session. Today our topics drug used in peptic ulcer disease. What is peptic ulcer disease? Peptic ulcers are chronic, most often solitary lesion that occurs in any portion of the GI tract exposed to aggressive action of acid peptic juice. Common sites of peptic ulcers are first part of duodenum, stomach, usually antrum, gastroduodenal junction, and within the margins of gastroduodenal stomy. This is a picture of peptic ulcer disease where an ulcerated area shown in the stomach and first part of duodenum. Pathogenesis of peptic ulcer due to an imbalance between the gastroduodenal mucosal defense mechanism and damaging force. Impairment of defense mechanism, ischemia, delayed gastric emptying, rapid gastric emptying, and psychological stress. Following mechanism occurs like decreased mucous secretion, decreased bicarbonate secretion in mucus, decreased mucosal blood flow, decreased epithelial regenerative capacity, and decreased prostaglandin elaboration. And increased damaging force are include increased gastric acidity, NSAID, steroid, cigarette and alcohol, and Helicobacter pylori infection. This is a picture that shows the imbalance between the hostile factors and the protective factors. Approach of treatment of peptic ulcer disease are lifestyle and dietary modifications and drugs. Lifestyle and dietary modifications include regular diet, stress-free life, avoid NSAIDs, quiet smoking and alcohol, weight loss, avoid hot, spicy and greasy foods. Now, drugs used in peptic ulcer disease. Number 1, acid neutralizer or antacids. Antacids include sodium bicarbonate, calcium bicarbonate, magnesium hydroxide and aluminum hydroxide. Agents that enhance mucosal resistance or ulcer healing drugs are sucralfate, prostaglandin analog like misoprostol and colloidal bismuth compounds. Agents that reduce hydrochloric acid secretions are H2 receptor blocker that includes the drug ranitidine, famotidine, cimetidine and nizatidine. And proton pump inhibitors are omeprazole, S-omeprazole, pantoprazole, lansoprazole, dexlansoprazole and rabeprazole. There are some antimuscarinic drugs also that reduce hydrochloric acid secretions are pyrenzipine and talenzipine. Some agents that kill the causative bacteria and responsible bacteria are Helicobacter pylori, and drugs used to kill the H. pylori are metronidazole, amoxicillin, tetracycline and clarithromycin. Antacid and mechanism of actions are, as antacids are weak base, they directly neutralize gastric acidity. Indications are intermittent heartburn, dyspepsia and peptic ulcer disease. Adverse effect of antacids are gastric distension and belching, metabolic alkalosis like milk alkali syndrome, osmotic diarrhea due to unabsorbed magnesium chloride and constipation due to unabsorbed aluminum chloride. Drug interactions. Antacid causes decreased abrasion and bioavailability of following drugs like tetracyclines, ciprofloxacin, imidazole and iron preparations. Most drug interactions can be avoided by taking antacid 2 hours before or 2 hours after taking meal. Proton pump inhibitors and its mechanism. Proton pump inhibitors are as administered as inactive product that then they are converted into active form in the acidic environment. The sulfonamide reacts with the hydrogen potassium ATPase. The proton pump forms a covalent disulfide linkage. Irreversible inactivation of the proton pump occurs. Then counter transport of hydrogen potassium ions via the proton pump is blocked. No secretion of hydrogen by the parietal cell. As a result, decreased hydrochloric acid secretions into the gastric lumen. They diminished 90 to 98% of the 24 hours acid secretion, both basal and mid stimulated. Now, indications of proton pump inhibitor as Helicobacter pylori associated peptic ulcer disease, NSAID induced peptic ulcer disease and perforation of bleeding peptic ulcer disease, gastroesophageal reflux disease, non-ulcer dyspepsia, stress ulcer, gastrinoma and other hypersecretory conditions. Now, come to the adverse effect. They are very safe drug, only 1 to 5% cases the following adverse effects are reported like diarrhea, headache, abdominal pain. Prolonged proton pump inhibitor therapy causes subnormal vitamin B12 level and echlorhydria. H2 receptor blockers and its mechanism: competitively and reversibly block H2 receptor on parietal cell. Histamine release from enterochromaffin cells by gastrin or vagal stimulation cannot bind to parietal cell H2 receptor, no H cell secretion from the parietal cell. And indications of H2 receptor blockers are gastroesophageal reflux disease, GERD, peptic ulcer disease, non-ulcer dyspepsia and stress ulcer. Adverse effect: H2 receptor blockers are extremely safe and well tolerated drug. Adverse effect occurs in fewer patients: diarrhea and constipations, headache, myalgia, fatigue and cemetery causes gynecomastia or impotence in men and galactorrhea in women. Now, misoprostol, it is a methyl analog of prostaglandin E1. Role of misoprostol in peptic ulcer disease: it gives mucosal protection by stimulating mucus and bicarbonate ion secretion and by enhancing mucosal blood flow. Prostaglandin causes acid inhibition by reducing histamine stimulated CMP production on parietal cell. And indication of misoprostols are NSAID induced peptic ulcer disease mainly. Now, treatment of Helicobacter pylori induced peptic ulcer disease, but before that we have to know about Helicobacter pylori. It is a gram negative bacteria, invade gastric mucosa, commonly cause of peptic ulcer and causes chronic gastritis. And we use two regimens to eradicate Helicobacter pylori, that is the triple therapy and quadruple therapy. Triple therapy is based upon a proton pump inhibitor taken simultaneously with two antibiotics from amoxicillin, clarithromycin and metronidazole for 14 days. Helicobacter pylori eradication is achieved in over 90% of patients. And regimens are proton pump inhibitor 12 hourly, clarithromycin 500 mg 12 hourly, amoxicillin 1 gram or metronidazole 500 mg 12 hourly, and total duration of therapy is 14 days. After completion of triple therapy, the proton pump inhibitor should be continued once daily for a total period of 4 to 6 weeks to ensure complete ulcer healing. Quadruple therapy should be offered to those patients who remain infected after initial triple therapy. The emergence of resistance to clarithromycin and metronidazole is an important factor in the failure to eradicate. Proton pump inhibitor in quadruple regimen, we should give the regimen as proton pump inhibitor 12 hourly, tetracycline 500 mg 6 hourly, metronidazole 500 mg twice daily, bismuth 120 mg 6 hourly, and total duration of therapy is 14 days. This is all for today. Thank you all for patient hearing and welcome for our next session.